So thank you.
Lorraine's signing in. Yeah.
Okay. And Kevin by telephone?
Yes.
Yes.
Good, thank you. 1, 2, 3, 4. Okay. So we do have 4. You said Lorraine was?
Yeah, I just talked to her. She's signing in on her phone.
Okay. All right. There you are. Okay. Okay. I think we can get started because we do have a quorum. Thank you all for being here. And so we have enough people here. We have, as far as I know, no public comment. The minutes, Steve sent out minutes from the last meeting. I disappeared from the video, sorry. Wasn't deliberate.
Oh, there you are.
There, okay, hopefully. And so we will start with regular reports. Ellen.
Well, it's been a long time. Not sure what you guys want to hear. We have been going through a lot of phases. We closed down. We started doing things online. We're doing a lot of Zoom activities. We're doing grab and go activities. We are keeping busy with all of that, trying to get people on and active and out doing things. I'll let Lorraine talk about the food pantry because that's been an interesting thing. So just trying to keep seniors busy and what they need. We are very slowly starting to open, which is not really open, but having, a couple of outdoor events in the coming weeks and months. We'll be doing a flu clinic and just do some things. Our goal is to keep people socializing and active and some sense of normalcy. Doing grab and go lunches. I don't know. We're just trying to stay busy, keep people busy needs. We've been here throughout. We've been working full time since the beginning, just in our offices, answering the phones and doing what needed to be done. So it's been a busy, different time for us. We've had to learn to be very flexible and switch everything we're doing 180 degrees and switch it another 180 and, just keep switching things. So that's where we are right now.
Good. So do you have some idea when senior centers will be allowed to open? Are they on some kind of government schedule here?
Well, it's very interesting. We just got something from the state last week. We've been waiting for a big state. I meet weekly, monthly with senior center directors throughout the state and our local ones. And they just put out a senior center guidance last week from the state, which was really interesting because it talked about you can start opening September 1st. And we're still in phase 2, under which the governor has said anybody over the age of 65 should be staying home. So how do you say stay safe, stay home if you're over the age of 65 and senior centers can open? So we're all kind of going, well, that doesn't make sense. So September, for the most part, what the senior centers in our area are doing is doing a few outdoor things. We're doing some meet and greets. We're doing, grab an ice cream and bring a lawn chair and sit underneath. We're not bringing people back into the building except for a flu clinic in October. And then we'll start doing things very, very gradually. That's really what we're doing. We're kind of waiting. So yes, we've gotten guidance, but it didn't really make sense. And because senior centers as a whole were never given the guidance to close down, we were the only group that wasn't told to close down. We never had to be told to, so we're kind of in a funny place. So we've all been doing what feels safe and yeah, I mean, and we never technically closed down. We locked our doors and we shifted what we're doing, but you know, we never stopped coming to work. We never stopped providing services. So it's just doing them differently, and we're doing them differently here too. We're having some listening groups. We're talking to people. Yeah. So I don't know if that answers it. It like I said, we waited for these long awaited guidelines from the state, which just confused the heck out of everybody because they said two different things. So it is what it is.
Well, that's probably true about most of the guidelines the state set out. Confusing to read and to pay attention to. It's one of the reasons why the library is, well, hopefully going to open next week, but most libraries in the state didn't open at the time the governor said they could, because they couldn't meet the guidelines.
Well, it's meeting the guidelines, and it's also, you know, knowing what your local area is, what feels safe, what's the right thing. You know, we have to do contact tracing on everybody. We have to do registration. So it's manpower, you know, asking us to bring people in the building and register them, take their temperatures, ask them the questions, clean up after them. You know, that would be tripling our staff if we did that the way we used to do it. So we're doing it little by little. Interestingly enough, throughout the state and everywhere, the big question is bathrooms. How do we handle bathrooms? You know, if you have people in the building, how do we handle bathrooms? Lorraine, oddly enough, volunteered to clean our bathroom, I think every 10 minutes. No, I'm just kidding because she's on the call. But, you know, I don't really want to be in there cleaning a bathroom after everybody goes in. But how do we do that? So they're biggish, you know. The little stuff is the big stuff now.
They are that is the big issue. And I understand from what the library is going through, actually, we may just close the bathrooms. You can't do the senior center. I realize that, but
can't do it. But we will probably, when we first open to people coming in, we will probably just have them in the building for an hour, you know, so go to the bathroom before you cut, to try to limit that. You know, right now, so that's what it is. Right now we're staying closed. You know, in September we'll open some outdoor things. Yeah,
that will be good. And hopefully the weather will stay with us.
That's the goal. That's the goal. But in the meantime, we're doing, you know, we had 25 people come to pick up craft packets today. We have, you know, a number coming every day for lunch. They can do grab and go lunch. We have, you know, 25 coming for a men's breakfast on Friday. So we're still providing services and people are still coming. We're out there greeting them. You know, we're still doing things. So we're busier than ever, just different.
Yeah. Okay. All right. Lorraine.
Yes. Okay. So the food pantry, I'll start with that since Ellen mentioned that. Well, we have been modifying it as we go along, and it gets better and better each week, I think, as far as doing the drive-through pantry. But we are getting ready to transition back to the food pantry in the town hall. We will not allow the customers to come in, but they will remain in their cars. So it's still kind of it's a hybrid drive-through. So they'll stay in their cars. We'll have volunteers running back and forth, taking the orders, taking them into the pantry where other volunteers will be filling up the bags, getting them back to the clients. And we will start in another week, actually, not next week, the following, with the Tuesday day pantry. And then we hope to bring, seeing how that works, we will bring the Thursday evening pantry there in early October, because we have Thursday evenings we have several people already coming in the evening. We just drop off bags here in front of the senior center for those who are working. Several have gone back to work, so that's a good thing. I think the total is up to -6, 30 - 8, it's about 22, I think, people who are coming in the evenings now. But we can't leave out anything perishable for them. So they don't get meat, they don't get vegetables and a few other things because, you know, bread, things like that, where bears could get to them. If they don't pick up for some reason, they don't get there, we can't leave that out. So when we get back to the pantry in the town hall, that will be better because they will have to come and they'll get the bags right from the pantry, refrigerated items and freezer items and that sort of thing. So we're excited to get that back going. Our volunteer coordinator, Susan Ludwig, has a lot of people, a lot of volunteers coming back. So that's been great. We've almost, I guess, almost not everybody is back, but we have several volunteers now working the pantry during the day and hopefully more in the evenings as well as we work towards getting the evening pantry going. We have one volunteer who's been inside here with us the whole time, who's really done a fantastic job of bagging everything and getting the food out and getting things all, put away after the truck comes, and we all kind of help to get everything off the truck and the pallets. So anyway, it's been a good experience and we're looking forward to the next phase. And, as Ellen says, everything changes from day to day. So we'll see what happens. So that's the food pantry. And then as far as what I'm doing, Renters Rebate is about winding down, and I've got most of them done. Still some are trickling in. I just got a new person who thought she might be eligible yesterday. She's never been on a radar before. So the word is getting out, which is good. That's what we want. And we're almost finished. That filing period ends October 1st. And of course, energy assistance has actually begun. The actual date of the start date is not until November, but we are taking applications now to get them processed and ready. So I'm doing everything by email, mail, telephone, drop off. We have that lovely drop box now in front of the senior center, which has been wonderful. So that's helping a lot to move along all of these applications, and people seem to be pretty happy with it. They're conformed. Some of them say, oh, I need to make an appointment to see you. And then I say, well, actually, I'm going to ask you to drop those documents off in the Dropbox and I'll work on it and I'll call you. And they're like, oh, okay. I keep forgetting that I can't see you. But it's working out very well so far. We'll see how it goes. As Ellen said, we're trying to move some things outside for this month. So my visually impaired support group is actually going to have a get together on September the 9th outside in the little, what do you call it? Little plaza area outside our, the town hall and the senior center buildings. And they'll be bringing their own food, their own chairs. And I'll probably have little bag desserts for them, and then we'll just be able to talk. We've been doing our meetings by just actually not even Zoom, because it's hard for some of the visually impaired to get on the computers, but by telephone using the feature that we have for group, having group calls. So that's been working out really well, but they're looking forward to getting out a little bit and actually coming to the center for a little picnic. So that's going on. I don't think I have much else to report. Things seem to be going smoothly as far as DSS and all those papers. People just drop them off. I explain them. I let them know if we have to do anything else. I do the applications. I get everybody to sign the applications for all of the different things that we have. And that's how I'm operating right now in social services and for the seniors that I see.
Okay. Are there more seniors looking for help?
There's one other thing I want to say. Yes. And I would say that's a good question. I have had some new seniors. Like I said, the Renters Rebate one was new, but also I've had several calls now on helping with doing Title 19 applications, my favorite thing. Yes, and these are people that I have not seen before. As far as for food and that sort of thing, I have had a little bit of an increase, not that much. But some, yes, some new seniors have asked to receive, pantry.
Mhm.
Everything else is pretty much not an uptick in anything else, because basically seniors' incomes haven't really changed in the pandemic. They're on a fixed income to begin with.
Yeah.
So, yeah, not much of that. Oh, and I did want to mention the farmers market coupons, because now our farmers market does take them. Yay. Thanks to you and Kathy. That's Betsy, that's been great. So I did distribute a lot of them before it was actually approved, but there are some that have asked me still for the coupons. So hopefully a few of them, I keep saying, and now you can come you don't have to leave Brookfield. So hopefully we'll get a little bit of the Brookfield Farmers Market will get a little bit of business, and it'll be easier for the seniors than to have to go into Danbury or New Milford. So that's been great.
Okay, good.
Yeah.
All right. Thank you. Joanne. Joanne did not.
Did Joanne get on?
No.
She's been trying, and I've been sending her. I keep giving her the information. I gave her the meeting ID. She had just called me earlier, so I told her I would speak for her if she couldn't get on.
Okay.
Okay, hold on a second. Can you hear me?
Yes.
Hello?
Yeah.
Okay. I have no idea what's going on with this stupid phone. I'm not doing this thing well at all. This Zoom stuff.
There.
Doing it, Joanne. That's the
As long as you can hear me, that's fine. Thank God everything is well here. I was just start my video. I don't. All right. Michael Steele had gotten in touch with me about a grant coming from CHAFA, and they were going to allow us to get some money to do a food pantry here, which wasn't going to work. But at any rate, long story short, bottom line was we got 30 ShopRite gift cards for $35 each, and they have all been distributed to each resident here. Made the residents extremely happy.
good.
Yeah, it was a nice thing. It was a nice thing. We got that. We got the money. We got a grant. They just gave us the money. No questions asked. It was lovely. So that's one good thing. Other than that, things are pretty much the same as they've been. We are working slowly toward getting the sidewalks done. We just got an architect to look, draw up plans, and we had a contractor. And, we're trying to do this like little teeny tiny baby steps, but we're working forward. At least we're not going backwards.
Always
And,
a good.
We do have 5 empty apartments at this point. Another one of our residents passed. And we're having a problem with people wanting to come and look at them, not because they don't want to come, it's they don't want to come out due to the circumstances. And so the property management is letting them know that, one way or another, if they don't come, then they're going to get put back at the bottom of the list. So we'll see if that will spur anybody to move. And that's about it. That's all that's going on here.
Okay. Any questions for any of these reports?
Joanne, I have a question for Joanne about Brooks Quarry, because when you said 5 apartments are available, and I've had lots of calls, as Betsy asked, and then I thought about it, for housing. I always do, and not that it's any more now than ever, but I do still have those calls. So I am telling them to go ahead and call Brooks Quarry. Is there a good chance that if no one on that list wants to come out, that these other people can maybe have a chance to get an apartment?
It's entirely possible. The one apartment, we are keeping on this, it's one of the handicapped apartments we're keeping on the side, because this is the one we are renovating and using to show what we can do with Brooks Quarry to upgrade and make these apartments a lot nicer, and hopefully be able to get more revenue from it. The other one, the woman just passed, so that's still got to be turned over and renovated and all that. 2 of the other apartments are in the final stages of getting themselves kind of renovated and cleaned up. One is finished and somebody is coming to look at that department, I think later on this week. So
Okay.
again, very small steps, but people are just reluctant to come out, especially here. The children are bringing the parents, and they don't want to, bring them someplace where they don't know what's going on. So, that's it.
Okay.
By all means, just keep, putting their names in, because sooner or later, people are going to start to get a little more comfortable and we'll be able to get things filled up. But just send them on over.
Okay, great. Thank
I
you.
have a question, Joanne. Who maintains that list and the order?
What list? Oh, that the office does that, the property management.
Okay, okay.
Okay, so we'll move on to old business. The fish program is operating at a fairly low rate of requests. But nonetheless, we are getting some requests and getting drivers to take people. So it's, I think hopefully soon things will pick up for everybody. Not everything can be done by telehealth. So people are going to need rides. I think right now we'll skip our seminar healthcare next spring. I think that if we move on to new business, the livable communities issue, which we had brought down to basically voting in the election. And we talked a bit about making sure that there would be drivers for people who want to get to the polls. Nancy, did we ask you to take this over?
Yes, I haven't done anything with this yet because we didn't know what was going to happen.
Mhm.
Yep. Yes, I think that, I mean, it's an issue and can be, we should see if we can contact both the political town committees and see if they're going to do it, we're going to do it, knowing that in November, it may be people not willing to want to ride in a car with somebody else, both from the voter's side and the driver's side. It is not everybody will drive. Fish does, we just say, if you won't wear a mask, you're not going in our car, and you have to ride in the back seat. But that has worked. Not everybody is comfortable doing that, and not everybody will be comfortable voting that way. The other issue we have for voting is the mail-in ballots. How do we make sure that everybody who wants a mail-in ballot gets one on time and gets it back on time to be counted?
Gotta send some type of communication out there, because everyone's gonna get an application,
Mhm.
Yeah.
all right? Everyone's gonna get an application, and you gotta fill out the application, and then it's gonna be up to the local Brookfield voters. Send out the ballot to them. They're putting this back into the control of the local town voter registrars.
Yeah.
So it's some type of communication we gotta get out there about do this early, right? Do this as soon as you get it. And I think that's a way we can really make sure they all get counted. Also, too, the fact that if they have the accessibility, we do have that mailbox right in front of town hall, where they don't have to put a stamp on it. They can just drive out and put it in there. Outside of that, this is why I think this took off a lot of the pressure that we were talking about at the beginning. Was we expected all these people to be at the polls, and we were concerned about the elderly. The elderly can very easily just avoid the polls by doing it this way. And it seemed that a lot of people did it for the primaries. A lot more people voting absentee than they went in and voted. And I actually voted absentee just to see how it would work. And it's fairly seamless. It was a bit of a delay of getting the application, because there was a problem with the printing house or something, but I did get it in enough time. I did walk it over, dropped it off in the mailbox. And I confirmed that they got it and they got it. It does work. I mean, it's just a matter of us making some type of communication out to everybody and say, we're going to do this. That you need to do it early. Now, as far as the political parties go, I think both political parties will have drivers that day. If people want to do that, we can get people all comfortable doing it the same way the fish program does it. They have to wear a mask in the car, and you have to sit in the back of the car. And I think if we put that out there, I don't think it's going to be a problem. Both political parties are going to be motivated to get their voters out. We all know that. So we're going to make sure, both parties will have drivers ready if we need. So between having the drivers ready, getting that communication out there to our voters, which we will do when we're calling the voters. We could definitely do that as we're calling the voters and making them aware of the election. And, then we can probably get out to them. Listen, if you look, usually the communication is, do you want a ride, we'll give you one. I know that comes from my party. I see it also come from the Democrats too. It's just a matter of, and we will, both sides be called to be unaffiliated. You don't have to worry about that. So everyone's going to be called.
Well, I think that what we need to do, you're right, this is getting the ballot applications in on time and getting the ballots back in time is I think going to be a bigger focus for this election even than drivers. And so I think it maybe what we need to do is make sure we know when, because I think I thought I saw something that there is a specific date when the ballot applications will be sent out. And so
it's fairly soon. It's fairly soon.
Is it?
Yep.
Yeah.
They're
Okay.
going to try to get them out as early as possible so they can get them in and you can vote, and then you can get your application and vote early, very early.
And I think our town clerk, I think Andrew's done a great job of the website and the frequently asked questions and having all that information there. So to me, I like to keep referring people back to that because that's straight out of the horse's mouth rather than us maybe, I don't want to misspeak a date or whatever. I think all that information is there. And I think as much as we can refer people directly to the questions on the website, I've done that in the newsletter. I think, Sue, it's in Spotlight this month too, right? So I think we're doing that and referring people back to the town clerk's website or call the town clerk.
Yeah, I don't have a problem with saying, yes, this is where you go. I just think the more we can do it on behalf of the Commission on Aging to get the seniors involved and get the seniors have enough notice to participate in the election. That's going to be our goal. Yes, and I just saw something that the state had also, which was actually recommending that you check to make sure that your registration is in order. So that if you're, even if you think you're registered, check again to make sure that they still know who you are and register if you haven't. So we can get that kind of information out, but clearly, referring to somebody else, never write your own stuff if somebody else has written it. And you can refer to that. So maybe we should put Steve and Nancy in charge of and making sure we get to the town committees and seeing if we can figure out what dates we're going to need to put out an extra push that says, the ballot application is coming to you now. Now is the time to look in at the website. For the town clerk and make sure you're participating correctly so we can get things pushed out on a regular basis, even if we're not having meetings.
Correct.
That sounds.
I am hoping by now that most of our seniors, if we said go to the town clerk's website, would be able to do that.
most of them.
No.
Not
Yeah,
all.
I think to that point, that one of the big things, and I agree with Steve, is letting people know about that ballot drop box at town hall.
Yeah.
Certainly there's been so much in the news about mail, and I don't want our seniors to be concerned or fearful about the mail. That drop box at town hall is secure. It's right there, and everybody can drop it in. And I think, to me, that's the biggest favor we do our seniors, is alleviating any worry and concern and anxiety about mail or issues or safety. Just drop it all in that drop box, and
you just have to
they'll
make sure
get
that
it.
you have to make sure tell them it's the white one and not the black one that's out there as well. Because people,
Oh, yeah.
I heard just yesterday that some of them dropped them in the black box instead of the white one. The
So
primary.
what is the black one for?
The black box is for all other town offices. They will in fact get it.
Oh, yeah, I know.
They'll get it. It's just, I mean, the one that says, I'm looking at the picture on the website, it says official ballot drop box. So
Hard to miss.
Well, I
don't know
but
what
it's
to say
white,
about
it's-
that. But they do,
Yeah.
if you get, I mean, we got stuff in our mailbox here. People drop it and they, it'll get there. But I think letting them know, make sure that there's a picture on the website, send out that picture with everything. Betsy, you're talking about advertising. Maybe we send out that picture so that they don't put it in the black box.
That sounds like a good idea.
Yeah, do
Yeah.
it that way.
Yeah, okay, we can do that. Yes, the other question, what I thought about could we go out and actually retrieve ballots?
I
And-
don't know, no.
Well,
No.
Yeah, so that was my next thought, is that
You're gonna
legal?
get us thrown in jail, Betsy.
Yeah, you can do the applications, but not the ballots, right?
Okay, the applicant, that's what I thought, because I remember bringing in an application for somebody.
You have to register as like an agent if you bring in more than 5. I mean, I would just tell them, go to
No.
the box and put it in. I don't want to touch anything.
Okay, that was what I
Yeah.
thought.
I would, Betsy, I just would want to keep us out in the middle of that,
Yeah.
because I'm just too afraid of the optics of that,
Yeah.
especially, I love my son to death, but I'm not going to jail for him. Okay, so. That's what will happen if I walk in with like 20 applications. Say, here you go. So I just direct everything to the box. I think it's the best thing to do. And just the little things. We got to remind people to sign the envelope, things like that.
Yeah,
There's got to be something we got to get out there on that one, because that's one I can see getting missed, and then your vote doesn't count. But I do like the fact that we're really pushing that mailbox because of the people. The one thing that will get the seniors out to vote and physically vote, and it might not be totally safe for them to do that, is the fear that their vote won't get counted.
right.
That's the one fear. If they hear that, they're gonna be, oh, no, I got to buy my vote counted. So we got to do everything we can to say, yes, your vote's going to be counted. Put it right here. Make sure you sign it. Make sure you do this, and alleviate that fear as much as we can. I'm open to any ideas we can do that in a very nonpartisan way, that we can just instruct the people to make sure it's signed, make sure it's filled out the right way, and make sure you drop it off in the box there, and it'll be a seamless operation. And we'll make the polls go a lot better the morning of.
Yeah.
It will really alleviate some of those crowds that we see up there, which was the big concern we had when we started this conversation.
Yes. Ellen, do you have very many people on an email list that you use to send out your newsletter?
I do. And this is all in there. I mean, it'll, we'll send it out. I send out regular emails, through the senior center, but I'll do a special, one as those dates come, and I'm sure the town will, we try to make sure it doesn't cross any political no-nos, but I think just referring people to the town clerk's website and that picture.
Yeah.
And like I said, I'm just looking at it online. It's bright red with stars around it. So if everybody does that, puts it on Facebook, and I'm sure Steve, your son, will be doing an email about voting at some point, maybe.
Yeah.
Do they do a
I think it probably
non-political
will be.
thing about that? Yeah.
Yeah.
I
More
think
than
just
likely they
sharing
will.
it, and I think just encouraging people that it's safe, that it's going to be counted. It's different for us here in Connecticut this year.
Yeah. Ellen, the one that it would be great is if we do, fingers crossed, get the center back open. And
Uh-huh.
maybe have Andrea come over one day for a lunch and learn if we have that opportunity. I don't know about the attendance in these type of meetings, but if we could do something, that'd be great. And just have Andrea come over and explain.
I'm not gonna have, we're not gonna be open by November
All right, forget it. All right.
to big numbers like that. You
It
know,
wouldn't
we
be-
do,
Yeah.
we'll come up with a flyer that we'll put on our Facebook, and we'll put it out, we'll push it out with everything that we do, you know, any, on our, on the website, on our monthly newsletter. And then when we have flyers like that, we post them out front. We
Gotcha.
print them
All right.
out, and we put them out with lunches. We put them out with everything that we do. But yeah, we're not going to be open enough to make it worth
All right, no
anybody's
problem.
time to
Okay.
come over. Yeah,
That was wishful thinking on my part. Okay.
yeah, mine too.
So Joanne, can you do that also at Brooks Quarry?
We can't hear you.
Joanne, you're muted.
She's muted.
Whoop.
She's not muted now.
Something always doesn't work.
You got it.
There she is.
We can hear you.
There you are.
Yeah.
Okay, yeah, I will put up some posters and let people know that they can drop their ballots off at the senior center.
Town hall,
Town hall.
Town hall.
town hall.
Sorry.
It's okay.
Okay.
We don't want to get
yeah.
Ellen arrested.
No rest.
Mailbox.
Yeah, I'll put some notices up because they're really not getting out much. They just come to get their mail and they kind of pop their eyes into the community room to see if there's anything in the inside mailbox, but they're really not hanging around. So yeah, I'll put up a couple of posters around reminding them that they can send take their ballots over to town hall, to the white box, you said?
Yeah, you'll see. It's right.
Yes.
You can't miss it.
And
You can't miss it.
It might be
because-
good to take a picture and attach the picture to your email.
Yeah,
Okay.
Joanne, if you go on the town clerk's
Oh, no.
website, like I said, you'll see
I think you'll see
a
it
bright
there, yeah.
red thing, and it's got a picture of it, and it says, please deliver to the official ballot drop box located outside of town hall. Even maybe just cut and paste that, and that's all you have to do, print that.
Okay. Yeah, because that's it. I don't email. Most of these people don't have computers. And unfortunately.
But if,
so,
well, maybe, why don't I ask Andrea, or I'll make up a JPEG of that, and you could just print that or pop it in your newsletter,
Okay,
you know, do that.
okay. All right, that'd be good. I could do that, yeah.
And I think maybe we ought to send out one email as much as possible, just making sure people are registered, because my understanding is those ballot applications are going to go to registered voters. So
Yeah.
you need to make sure that you are registered now.
Absolutely.
Good
point.
Okay,
So, and that, my guess is you can probably do through the town clerk's office. I don't know whether,
Yeah, they'll tell you right away. And
Yeah.
you can look it up yourself, actually, but if they want you to just go to call up town clerk's office and ask.
yeah, because that's the first step. Okay, and then, okay. So I think, yeah, if we push this in, I think, yeah, well, I would, Steve and
Yep.
Nancy, contact the town committees and say, yes, if you're gonna do driving, if people want to do that, that's fine, but, these are the rules you need to lay down for both sides. Everybody has to wear a mask and
In the back.
the voter sits in the back seat.
Right.
We actually have a fish driver who installed a plexiglass panel.
Wow.
That's cool.
That's good.
Yeah, which is good. I can't require that, but that if that's what somebody will do so that they can keep providing service, that's
amazing.
I'm
Yes,
impressed
it
with
is.
that thing.
Yeah.
Yes, I am too. Okay, I think that we can push right along with this and make voting, everybody gets to vote and everybody gets to vote safely and on time. Be a good deal. I have one other issue. It's not an issue. The town set up a committee to look at long-term needs related to the COVID-19 crisis. Mel Butow is the chairman of the committee. I am on it with about 4 other people. Specifically, I was volunteered because of the Commission on Aging to make sure that we know what it is we are doing in the long-term process. What can we figure out if we're missing something? It's the hardest question you can ever ask most people is, what else could we be doing for you? Because if it's very hard to consider that as an issue. But this is such an odd thing. We have emergency management group in the town for what wind up being short term for most of us, like the last storm we had, the macro burst, even though they seem to go on forever, but they're not. It's short term impact on the whole town, but this is long term. By now, we all know that we've been at this for far too long. And it impacts everybody. It was nice that whoever said, yeah, seniors are not having trouble with income. It's the one time to be old in some ways, because you have settled, you have an income that is not subject to real problems. But are we missing something for seniors that we could do? And how did the senior center, and I think things like the library, parks and recreation, for town services, how did you go about figuring out how to provide services for a long term in a very different way than you've done it before? And do you think that there is something else that could have been done, and can still be done? As a matter of fact, since we're not through this yet, and we don't really have any idea when we're going to be done.
I think, as I said, we pivoted 180 degrees, and I see, do I think we've done a good job? I think we've done a lot. We've done more than some towns. There are some towns around us that their senior center and basically social services just kind of closed down for 3 months, and they haven't been heard from. So that's, sorry, my battery's dying. I'm going to move. So, can we do more? We are limited a lot by our staffing, and that's really it. This is what we're doing now is very labor intensive and time intensive. And when you talk about opening up and cleaning and all that, it's very labor intensive. And so we are very aware of our lack of staffing. We use a lot, we've always been very proud. We've been able to expand our staffing by using volunteers, and don't have volunteers right now. I don't have my volunteers in. So, we're folding our own newsletters. We're doing all our own stuff. So it's really, that's been our big thing, but that's a problem throughout Brookfield, and that's budgetary problem. So if you guys can solve that, more power to you.
What conditions do you need to have more volunteers?
Well,
You're
we
not
have
letting them
volunteers.
in,
I had volunteers doing my newsletter at first, but they weren't going out. So I was having to drive to their house and then go pick them up and then wait a day. And then, it's just easier to do it myself in front of my TV at night. So we do have some volunteers we're using now, but again, I don't want volunteers in the building, both for their sake and for ours. We're working in very close confines right now. So, we are using some volunteers outside, but we're being mindful, we're protecting ourselves. That's the other thing, is we're protecting ourselves. We're protecting them. And from the beginning, it was Lorraine, Amy, and I, and, some of the crazy things people wanted to do, we said, no, if one of us gets sick, honestly, even now, and we've all been in close contact with each other, there's nobody here. We don't have a big enough staff to have people in and out. So we've been very protective. And that's just the way it is. Using more volunteers, we can't right now. And it's the age of the volunteers, and it's the ability, we're using them. They're delivering food, they're making calls, they're doing what we can right now, but it's nothing beats a dedicated full-time staff person that's coming in come hell or high water. And that's just the way it is.
Ellen, maybe you can mention about the volunteer program, the call program that.
Yep, I was going to do that when we finish this.
I was
Yeah, I
just
want to
gonna
do that. I'm
say.
excited about that.
Yeah.
What program is this?
So this is a new program that, as I said, we've been meeting with all the senior center directors, and we're worried about seniors, and an interesting group, motion picture group out of California, that started this about 5 years ago with their volunteers, and using, kind of retired actors to make calls. They have a very strong union and a strong group out there. And they started what they call Daily Caller, where their volunteers call seniors, every couple of days, very similar to what Elaine has been looking at, what we've all been looking at wanting to do. Over the past few years, they've gotten grants and money out, and they have designed a program that has two things. One, it has a training program of how you recruit volunteers, how you train them, how you talk to them about confidentiality, how you talk to them about boundaries, what they can talk about, what they can't talk about. The second piece that they have that's so interesting is a call hub, where Nancy would be a caller, and Nancy would call into this 800 number, put in her 4-digit code, and it would say, do you want to call Sue or Elaine or Betsy today? And she says Betsy, and so then it just automatically calls Betsy. So Betsy gets a call from Nancy, but it's an 800 number, and Betsy knows that number, so Betsy doesn't have to worry about Nancy's cell phone. You're not, and it's nobody's exchanging last names or phone numbers, so it keeps some of those boundaries in place. And it's just a social call. It's social connectedness. So Nancy was kind enough to do a training with me last week.
Yes.
We did a training last week. I got the paperwork from them, which I haven't forwarded to her. And we're going to look at that, and we're going to talk about starting something like that, rolling it out. Right now, they're offering it for free because of the pandemic. They feel like they've got a great program, which they do, and they feel like it's very useful. So they're talking about rolling that out, and we want to see how that would work for us. It answers a lot of the problems that Elaine was coming up to, and the boundaries, and there's training. Like I said, the training is excellent. It tracks calls. It does a lot of stuff. So I'm very excited about that.
Sounds good.
Sounds wonderful.
And then
Yeah.
the other thing that I thought was very interesting about the program, like if I was calling Betsy and I wanted to do something extra with Betsy, we became like, again, you have to have the boundaries. But if I wanted to take Betsy out for coffee, I have to sign a form that I'm quitting the program and that I'm just going to become friends with Betsy. So there would be no liability issue.
So and it's exciting because as the pandemic started, we put into place a group of volunteers, just kind of, we reached out to a variety of people to do these kind of calls, because it was important to us to reach out to all of our seniors in the community and how are you doing? What do you need? Do you need groceries? And just to check in on people. And it was very successful. We did find some problems. We did find some people kind of overstep those boundaries. And, that's been a concern of mine. Because of the pandemic, we just kind of had to do it by the seat of our pants to make sure people got calls. And if we're going to institute something long-term, we know some of the pitfalls and we have to be careful of them.
Yeah, it sounds like
It's an exciting program. Yeah.
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 So now it's free, or
Right now it's free. They're offering it for free. How long that lasts, we'll see. She's trying to get grants. They've really rolled it out. The call that we were on, Nancy and I were on this training last week, and it was meant for, we had signed up to do it as senior centers and directors in Connecticut, but there were people from all over. So I think they have a useful product that the use of it has become more important during this time. And, you know, I'm sure eventually there'll be a charge to it.
do you have, did they talk somewhere about how you get clients? I mean,
It's really, yeah, I mean, you're advertising, you're going through your people, but there's a registration, there's an interview process, but they really, it's kind of tested. They've gone through this for years. And so they have the question, you know, they've done a lot of it for you. A lot of the pitfalls they've solved, and they're there as a resource. So we'll let you know as we get into it a little bit further. We're doing baby steps.
Yeah, good. Sounds good.
Yeah.
All right.
So I have one other thing that, let me put my phone right here. Can you still see me? Sorry, yeah, okay. One other thing I wanted to tell you guys about, and Lorraine and I are involved in this. This is in response to the activism and the issues with police accountability throughout the country. The state of Connecticut has mandated a Police Accountability Act for all the police departments. And as part of that, Jay Purcell, Chief of Police, has reached out to us. It's a small part of it, and it's not the police accountability yet, but it's come out as part of it. And so I wanted to let you guys know we're part of forming a community conditions task force, less about just the police, but more as far as looking at the police, social services, the senior center, the health department. Who else is on it, Lorraine?
Zoning and zoning, and is there, I think that's about it.
Yeah, but all of us who, you know, may have contact with a person with a problem, whether it's a homeless person or whether it's a domestic violence person, and a task force of town employees that would meet monthly, of people that are connected and that have the resources, and to try to kind of solve some of these things and discuss them, not in our silo of seniors or social services or police, but as a group, because we're in touch with some of the same people and we don't even realize it. So that we're looking at kind of getting started this fall. I think it's exciting and it's necessary. And maybe partnering with some other towns for, you know, some resources that are out there.
Like health services.
Yeah.
Yeah. There's also how seniors would be kind of involved in this is that the police do a lot of wellness checks, well checks for older, you know, people like people are concerned about their mother, father, are they okay? You know, we haven't heard from them. So this is really important for seniors as well, rather than the police going out, they're thinking, or the police and social services could go out together. Could there be other services, you know, because the police might go and say, okay, everything's fine, but then, you know, they're just kind of left there again. And then maybe they could be hooked up with other services that might help them. So it's a coordinated effort. And also, I know, Betsy, as you were talking about what do seniors need, I'm thinking, yes, they're financially maybe in an okay state at this point with the pandemic, but as far as social isolation, I think there's a lot to be said.
Yeah.
Mental health, you know, seniors are not likely to access resources to mental health. You know, it's kind of like the older generations, like, you know, that's just, you know, I don't need that. But honestly, I talk to a lot of seniors who are, you know, are becoming depressed and You know, they can't see their grandkids. They don't see very much of anybody. They can't get out and do what they used to. So there's a lot of that. And I think there needs to be more, maybe your group can look into that as one of the areas that might need some more work, some more coordination with other agencies, mental health agencies, or, you know, how can we make sure that seniors are okay mentally and spiritually and emotionally? You know, that's a big thing. They can't go to church. You know, there's a lot of things that I think that we could tap into where they do need a lot of resources and a lot of support.
You're right. I think that's sort of surfacing as go along in this. I don't think anybody thought about it initially. But
Yeah.
the longer we're in this,
Yeah.
in this mode, the worse it's going to become. And so then things like, besides us, organizations like Brookfield Cares, need to be, you know, they're part of this, hopefully part of the solution and part of recognizing the problems in addition to the town services. So we need to make this long-term committee look at not just the town, but look at what else is available in the town, what else can provide services. So it's always a worry with when you tell seniors that 65 and over stay home. Well, yeah, but then you don't see anybody.
Well, and nobody thought that, you know, I mean, when we closed the senior center, we said, oh, it'll be 2 weeks. We'll see you in 2 weeks.
Yeah. Yeah.
And, you know, here we are. It's
Right.
well, we're almost at the 6-month mark.
Yeah.
Nobody knew. So yeah, a lot of things are coming to light, and, you know.
Yeah. A lot of things are showing up, increase in divorces, increase in suicides,
Domestic
drug use.
violence.
Drug abuse. Yeah.
Yeah.
Mhm.
Yeah.
The other thing is going to be, you know, once there is a vaccine out there, is providing the resources to get people vaccinated. That, you know, I've been talking to the VNAs about that, you know, having them in. How are we going to go about doing that?
Yeah. Yep. It's going to be a problem.
Yeah.
Cheerful news, guys.
Cheerful news.
Yeah.
Well, so we will keep looking for things that we have missed. And you're right, Lorraine, that this social isolation has come up sort of late in the game, but clearly it's a very important topic that we need to address. And hopefully somewhere this calling system will be able to alleviate.
Well, that's a piece of it. That's certainly a piece of it, you know. It is funny though, you talk about the senior center being closed, and we're on these calls with all the senior center directors, and we all laugh because we're all closed and we're all telling seniors, stay safe, stay home. We're doing, you know, we're killing ourselves to do the calls, to do the packets, to do all these things to keep people safe. And then you look out your window and 3 cars pull up and they jump in somebody's car and they go off for the day. And you're like, what? You know, and some of them have just gotten tired of it and they've just said, we're done.
Right. Well, yeah, and that's the worry for.
That's a worry. Yeah.
Is that we'll all, I mean, we're all getting bored with this stay at home nonsense. So, and that's the scary point at which we can all problems. And we can just go back up with many more infections. We don't need that. We're not going to solve that. So we have a lot to look forward to. Voting as one issue in this long term, and hopefully we can get this calling system set up and organized. And so anything that you can all do to encourage anybody you know to make sure they're registered to vote and that they do vote safely by mail. Yeah. Right. So thank you. Anything else anybody would like to? Okay.
Yeah, how you doing? Really quick, with the Knights of Columbus, right? They did a helping hands thing for the last issue we had, big storm. We cleaned up people's properties and all that. Just putting it out there that if anyone knows of a senior that's having a problem with their property due to the last storm,
Oh,
and they need some help just cleaning it up.
Oh,
Just reach out to
Wow.
me, and we'd be more than happy to do it. We did it for two households already, and it worked out really good. We had about 10,
we
15 guys
didn't
show
know
up.
that, Steve. That's great.
Yeah, so if
Yeah,
you let that out there,
that is-
let people know, we'd be more than happy to do it.
Good.
Just have them reach
Okay.
back out to
I
me.
might have someone for you. Do I have them call you or should I call you?
You
or-
can call me directly, or you can call me, so I'll give you my number,
Okay,
203-770-4424.
okay, great. Thank you, Steve.
Welcome.
Thank you, Steve. That's nice.
That's wonderful to know.
Yeah.
Yeah.
Okay. All right. So we will then adjourn.
Thank you, everybody.
Thanks all.
Thank you.
Thank
you.
Thank you for doing this, everybody.
Yes.
Take care.
Thank you, Dan.
Thanks a lot.
Be safe.
Bye-bye.